How would you say that you use chemistry every day?
So we use chemistry when we figure out drug dosages. We decide which antibiotic or medication to put an animal on. When we're calculating anesthetic doses, we use chemistry all the time in veterinary medicine.
Okay, and would you consider your job to be stressful?
It can certainly be very stressful because we can have emergencies and we need to be able to calculate things quickly. We need to know what's going on with the animal quickly, and it is stressful in many ways with emergencies and with making decisions daily. We have a really fast-moving pace around here.
What are some common accidents, not necessarily made by you, but...
So accidents that could happen would be miscalculating drug dosages, not considering drug interactions or pre-existing conditions that you might want to avoid certain drugs. There's plenty of potential for accidents, so we have a lot of backups, like having at least 2 people calculate doses, especially when you're doing anesthesias and things like that. We will always have somebody backing it up and checking it. And when we fill drugs, we have somebody to verify the drug before it goes out.
How do you administer anesthesia?
So we have some injectable anesthesias where we either put it directly into a vein or inject it into the muscle for short procedures where we just need to check a wound or get an exam on an animal that might be upset. And then we have inhalant anesthesias as well, where if we're doing a surgery or a dental cleaning, then we would want to put them under general anesthesia, and that would involve putting a tube down the trachea and the animal breathing an anesthetic gas.
What obstacles do you face?
A lot in veterinary medicine is that the animal can't tell us what's wrong, so sometimes we have to go through an anesthesia or something like that just to find out what's wrong, or different testing. Obstacles to drug use could be sometimes dogs won't take pills or cats. Sometimes they won't take their medicine. They spit it back out. So you have to really watch out and go with what the animal do. That's a big thing in veterinary medicine. So that's one obstacle. Other things is certain drugs can't be used in certain animals. For example, wouldn't want to use certain drugs in greyhounds and different sight hounds or boxers or some dogs that are sensitive to certain things, or cats. So there's a lot of things to consider.
How long does it take for the anesthesia to become effective?
So some anesthesia is very quick acting. If you get it injected into a vein, within just a minute or so, the animal may be getting sleepy. If you end up doing an injection to muscle, it might take 5, 10 minutes, 15 minutes for them to get the full effect. With gas anesthesia, it's pretty quick, but you usually have to do a pre-medication with a different anesthetic in order to be able to put the tube in. So basically, most are very quick acting. The shortest acting would be if you gave a sedative at home by mouth. It takes probably an hour to work that way.
And do you use different types of anesthesia, and if so, when do you use each type?
Yeah, so there are a lot of different types. The injectables might be for a dog or cat that does not want to be examined, and so we have to give an injection. Otherwise, like I was saying before, the gas anesthesias are for surgeries, longer procedures, dentals, where we need the animal to be asleep and have the maximum amount of pain relief and relaxation for the procedure. Sometimes we might even use a sedative, such as an oral sedative, like a pill you give at home, or an injectable for something like taking x-rays. So there's a lot of different uses. It depends on how long you want them to be asleep and how deeply they need to be asleep and how much time you have.
Okay, thank you very much.
Thank you.
Why don't you introduce yourself?
I'm Dr. Amy Butler, work at Bowman Animal Hospital.